What's up, everybody? It's good to be back. How you doing tonight? Been a busy week for me, man. Between a couple 24-hour calls, all-day barbecue competition, work being insane. I got another 24-hour coming up tomorrow, by the way. Glorious career in medicine. But yeah, been a good week, despite being busy. Hopefully you guys have enjoyed yourselves. Have a nice midweek break with me. Thank you for coming out. I always appreciate you being here and supporting me. Can't see me? That's just my voice right now. I'm organizing some stuff. Can you see the starting soon screen? You're about to fall asleep. Well, I'm gonna wake you up. Yeah, if it's the starting soon screen, that's what we're working with. That is good. Let's switch that. Can you see me now? Hi. Hello. I'm here. When it says the stream is starting soon, what am I doing behind the scenes? It's none of your business, man. No, I'm just kind of moving stuff around and like nothing seedy or lascivious, I promise. It's all just like organizing stuff and basically making sure that I'm not doxing myself any more than I already do. Which, speaking of which, Twitch has done a pretty damn good job of that for me, apparently. I don't know if you guys heard, but Twitch got like massively hacked and essentially just like leaked everything. So yeah, everybody change your Twitch passwords if you haven't already. Probably enable two-factor authentication too if you haven't done that already. Welcome to the modern era where that shit happens. I'm actually kind of surprised that hadn't happened previously, but in any event. You found out that I make millions via my Twitch streams? Yeah, exactly. It must be my 8 viewers that are really pouring cash into me. I wish, man. It seems like everybody's kind of like doing, like I saw on my YouTube feed, there was, I don't watch Asmongold, but he was talking about how it leaked that he makes like $2.5 million or something. Like, good for him, dude. Good for him. But I'm sure there are some people who are super pissed about like that money being, you know, public information. I mean, everybody sort of knows that they make a shitload of cash anyway. I'm not sure why that's like why that makes any difference, but yeah, I am also a Twitch millionaire. I am a social media and live streaming mogul. I make a fuckload of cash because of all of you folks and your ardent support. So thanks for coming out, guys. I'm gonna go sail away on my yacht now. Take it easy. So yeah, here's what I've been doing. So this is like my last week in a nutshell, basically. So I did this. I don't know if you saw a while back. I did this. Basically, I bought a thing of maraschino cherries, dumped out the juice, and just filled it with bourbon. Because I wanted some cherries for Manhattans, and I wanted to do it the very lazy and inexpensive way. It's like, normally if I was doing this right, I would actually get, like, real cherries and, like, you know, cook them down in bourbon and sugar and, you know, actually kind of, like, candy them properly. But ain't nobody got time for that, so I poured a bunch of bourbon and maraschino cherries and just said, let's see what happens. And as it turns out, the bourbon they're soaking in is freaking delicious. It is unreal. Like I didn't even consider that being a thing. Like that wasn't the point of this at all. It was to make booze cherries, you know. But like I decided to taste some of it and I was like, holy shit, it's awesome. So here's a glass of cherry bourbon with booze cherries. Ah, serial killer, what's up, dude? I knew you'd be by, given that this topic is basically your inspiration, pretty much. So, thank you for that, by the way. How's your Wednesday going, man? Everything cool? Having a decent week so far? I'm just talking about bourbon, daydreaming, things that I can do when I no longer am employed. You guys were both here for me talking about my barbecue expedition. By the way, I'm actually using my Instagram now, so check that out. I am not an interesting person, but I'll do my best to make it look that way. Giant salad. You and your salads, man. You must be like... Are you secretly a rabbit? Are you a fucking rabbit? Just like a lab rabbit or something that they taught how to use a computer and type really well? What kind of salad was it? I, too, have developed an affinity for salads. My wife makes a really good steak salad. But yeah, barbecue was good, man. It was a little more pro than I'd expected, quite frankly. Oh, I just like my own thing. That's douchey. Yeah, so that's my smoker, actually, right there. The Weber Smoky Mountain. It's delicious. I need to eat more salads. Yeah, the fiber, dude. You gotta get that fiber. So one of the dads at my kid's school is like I forgot what his title is, but like director of operations or something. The quarantine has not been kind to me, dude. I know that feeling. But fortunately, I live in Missouri, so everybody kind of like forgot that rules exist, sometime last year. So we I've been back at the gym for a while, but yeah, I definitely felt the quarantine flab coming on. Yeah, anyway, this dude works for a distribution company that basically distributes all of the Coors and Miller products to like most of the Midwest. So he's like, yeah, we can have a beer truck there. So there's our beer truck, which I did not expect. And there's just a different view. We were just like on the soccer field. So like all these dudes were cooking stuff, and like some of these people were super pro. Look at that freaking smoker back there, man. It's a giant ass like multi-compartment smoker. This guy is apparently a nuclear physicist and also a ludicrously good cook. So as it turns out, like this was like a legit competition. Like I was under the impression that this was just gonna be a bunch of dudes showing up and like making food and getting drunk. But like these guys over here and this dude like came with their game faces on, and they cooked some unreal food. This guy, so the categories were kind of weird. Did I win? No, I didn't win. That's where the story's going. But it was well deserved. So the categories were let's see, chicken, side dish, ribs, and wild card. Yeah, I know. Sad panda, right? Sad panda. But the wild card was basically like everything else, right? So like sausage, brisket in my case. I cooked a brisket. And like whatever else you wanted to make, like wings or whatever. So this guy's wild card entry was a smoked bourbon peach dumpling, which was one of the best things I have ever had in my life. It's one of the most delicious desserts I have literally ever had. It was so good. Like just super lightly smoked peaches, and he like wrapped them in phyllo dough and fried them real quick, like at a cast iron skillet. It was just like perfectly done. Like I tasted those. He had like one. It was like giving everybody samples, and I was like, well, I'm fucked. There's no way I'm winning the wild card. But I was second. I was number 2 behind the peach dumplings. So that's something. Especially since it turned out that they were like I said, this was actually like, sort of semi taken seriously. And I had like 8 hours to cook a 21-pound brisket. So I was just kind of like, that's normally a solid 16+ hour smoke. So like literally half the time that I probably normally would have spent on that. So yeah, that was interesting, but it turned out really well still. With vanilla ice cream, yeah, hell yeah, man. Like a really strong vanilla bean or something to go with it. Yeah, that would have been fantastic. That would have been a complete dessert and a like mouth orgasm hardcore. So yeah, barbecue was good. Met a lot of cool people. Had a good time. My wife was exceptionally gracious that day and basically volunteered to be a single mom more or less all weekend. Because I was on call Friday and Sunday, so gone. And I think I was only home I was home from 7 a.m. to 9:30 and then 2 to 4:30 or something like that. This is what I did to hurt myself while I was on call. It's like self-flagellation. Delicious self-flagellation. Some ghost pepper hot sauce and Carolina Reaper powder, I don't know, it's like seasoned salt with Carolina Reaper peppers ground up in it, basically. Put them on a burrito. Fantastic, but you get to enjoy it twice. And this is my son. You may not know it, but he is a train. I am sure I did not give him that burrito because he freaks the F out. He can't handle any spicy food at all. He can't handle any spicy food, which is a problem because obviously I really like spicy food. So yeah, this was we go on this train at our zoo and it sounds exactly like that. But yeah, he's holding those little mallets for his xylophone, and that's his throttle, and it's crazy because the train at the zoo has handles that look exactly like that, and it's all squeaky and shit. Yeah, it's crazy. And I listen to that, probably 5 hours a day, no big deal. So this is what I did last night. This is super cool. So if you were ever in the Kansas City area, I 100% recommend going to this place called the Farmhouse. So it's owned by a friend of a friend, and he clued us in to this tasting meal that they were gonna have at the farm. So one of the nice things about being in Missouri is all the meat here is unreal. It's all amazing, and I forget about that until I go somewhere else. But the meat here is just absolutely incredible, and produce is really good too, because it's all local. So we went out to this farmer's house. It was literally on his in his backyard basically, and he was one of the sources for this restaurant, and it was about 45 minutes north of Kansas City. And basically they just they cooked all of the ingredients were from his farm. So they made rabbit, this duck confit, seared duck breast. Broadway Coffee is a local coffee place here, and they make their own coffee, obviously. And the short rib and the warm apple fritter. Oh my god, that apple fritter. And so, as you can see here, all of these were paired with a wine, and it was it was a beautiful night out. It was probably mid 60s or something, clear. It was supposed to rain, which would have been a real butt fucking. But it's yeah, that turned out to be a unbelievable dinner. So here are the dishes. That's the agnolotti, excuse me. And it's sort of we were out there. Dinner started at 6, and they paced it really slowly. My phone is going insane. I need to turn that off. Oh, what's going on? Interesting. Apparently, one of my old friend's moms died. That sucks. Bummer. Anyway, so short rib. But yeah, I was at sundown and it was dark. It had just gotten totally dark when we finished our dessert. And this was a hot chocolate. It was freaking good. And I put Irish cream in it. Delicious. So that and work is what I've done in my last week. So it's been lots of ups and downs. So yeah, as the title would indicate, we're talking about COVID and the long-term effects today. Um, that's a pretty cool topic in my mind because it's like it's emerging science. You know, we're just getting to the point where we know some stuff about it and have decent data because enough people are coming out of it. But yeah, check out the Instagram. I'll be trying to post to it a little bit more regularly, so you can have an insight into like what I actually do, kind of the highlights of what I do. You know, as much as social media can actually tell you about my life. Anyway, yeah, our friend Serial Killer here tuned me into this really good article here in my Discord, which you should join, by the way. It's linked in my Twitch account. I have issues, like it should be in a command, but it seems like that never works. Does that actually work? Nope, never works. Even though I always tell it every time to, save it, and the invite never expires. I don't know why that doesn't work through Stream Elements, but whatever. Anyway, if you want to join my Discord and like talk about weird shit, mostly medicine, go to Twitch and click on my About page and join. Anyway, so Serial Killer, thank you, sir, for this very interesting study that kind of prompted me to go down the post-COVID rabbit hole. So, to summarize this, basically, people have bad shit happen to them after COVID. So, this is a study out of Wuhan, where 1 year later, after, patients had COVID, they surveyed all these people and had a fair amount of them excluded for various reasons. Long story short, may not be, like, super surprising, but people who had COVID had higher chronic obstructive pulmonary disease assessment test scores. Now, I don't actually know what questions or, evaluations they do for that test. It wasn't totally clear to me from this, but maybe I just missed it. But so if you have any insight on that, let me know. But in any event, I thought this was kind of interesting. So the most common side effects after discharge were fatigue, sweating, chest tightness, anxiety, and myalgia, which, like, fatigue, I guess, makes sense because that's just sort of a general, sickness symptom. All the rest of it doesn't really track to me. Like, maybe chest tightness, kinda, if you're having respiratory issues, but those seem like weird chronic symptoms to have. So, I guess that's why we do science, right? You figure out shit that you wouldn't expect. But what definitely makes sense is, one, this. So people, who have a disease that primarily, like, compromises your respiratory function have compromised respiratory function down the line, right? That seems pretty reasonable. And the other thing that also seems reasonable is that severe disease during hospitalization was a risk factor for more symptoms and higher chronic pulmonary disease assessment test scores. Like, so basically, if you have more severe disease, you're more likely to have, severe symptoms down the line. So the reason that I find this topic very interesting is because we at our hospital are starting to subjectively see way more people complaining of these symptoms. But really, the way I see it, and why I find this list here interesting, is that the vast majority of the people who I see complain of, so fatigue is one, but like respiratory issues, like they don't have the stamina that they used to. Some of them still find it difficult to take a deep breath. Some of them are on oxygen. I've run into several people who, like, previously had, let's see, I think all of them who are newly on oxygen, who I have seen, did have asthma, but didn't have, like, it was, like, controlled. It's like normal asthma. So they did have a risk factor for respiratory disease, but now they're, like, on oxygen, and that's, like, a huge deal. being like, imagine not being able to oxygenate yourself just by breathing. Like, I think people underestimate how sick you have to be for that to be necessary. So that's actually what really set me off, because I had 3 patients in one day, probably about a month ago, who said that. Like, those 3 patients all were like, yeah, I had asthma, but it was under control, like never gave me any problems. I use my inhaler like once every couple months, and now I'm on oxygen. Like, okay. Like, after having COVID. Like, they just, they were on oxygen in the hospital and just like never got off of it. Couldn't tolerate it. Is this for hospital COVID? So it's for COVID in general, but as I touched on here, this is more likely in people who had severe disease and presumably were hospitalized because of that severe disease. But again, this is all like emerging data, right? Like, this is still, sort of like a scientific pioneer kind of thing. We don't know a whole lot about it, which again is why I kind of think this is interesting, because I have just started seeing these people who have like chronic issues after having COVID. So that was kind of my first like introduction to actually having to deal with that. Like, chronic post-COVID symptoms was something that we were all kind of aware of, like, we being physicians, like, we were aware that was happening and like a possibility, but it seemed like that was mostly due to, maybe something else, like a secondary pneumonia, or they had tons of blood clots or something while they were admitted. So that actually is a good segue into this, not this. Well, actually, yeah, let's go here first. So this is an older study, September 15th, 2020, that notes COVID survivors having, quote, lung trouble. And in this little article, and I can link all these articles if you guys are interested in reading them for yourselves, but in here they note basically that COVID makes you hypercoagulable. So lots of people have like increased tendency to blood clot. So this finding points to the way the SARS-CoV-2 virus, covariant 2, seems to enhance tendency towards blood clotting, which is something we figured out, relatively quickly. Like, September is not bad to have the NIH director actually comment about something publicly. And that's also why people are anticoagulated. COVID patients are anticoagulated therapeutically while they're in the hospital because they're hypercoagulable. So it's possible that some of these like lung symptoms are basically due to like microemboli. Basically, they just have like tiny little strokes in their lungs. Like, thousands or millions of them. And so that sort of begs the question, if that can happen to the lungs, can that also happen to other organs? And the answer is absolutely. So you can have strokes, like proper strokes. Other organs can fail from like all these small emboli and all that stuff. Are the microemboli causing the neurological problems? Maybe. Yeah, maybe. That is entirely possible. So what I was originally going to transition to is this study, which is about strokes in COVID patients. And they found that patients hospitalized with COVID are roughly 30% more likely to have a stroke than the general population, which, is a pretty substantial increase, but honestly not as much as I would have expected. But if we have time, could we look at a video of a doctor talking about natural immunity versus vaccine immunity? Sure. If you can find such a video, that would be awesome. Possible for brain tissue from microemboli to heal. I doubt it. Usually your brain is pretty poor healer, generally speaking. But that said, if you bust the clots, like if you get anticoagulated and those clots go away, and you restore blood flow to the neurons before they're actually dead, then that can heal them. But I think once they're dead, they aren't going to come back. why, yes, we can watch this video. I would very much enjoy that. Oh my god, it's loud. Oh my god. Sorry. Sorry, folks. That was much louder than I expected. Yeah, we'll watch that in just a minute, actually. That's awesome. What other causes could there be for the neurological issues, like loss of taste and smell? So the loss of taste and smell is a weird one. I've never actually looked into that, but for that to be, so what's a good way to say this? For those nerves to be selected, suggests that that is not a systemic phenomenon, right? So, like, that's probably, because the virus, like, gets concentrated in your nose and, like, your oropharynx, basically, like, it's probably just affecting those areas more. So, like, when you have a cold and you're stuffed up, you can't smell super well. But it's probably a little different because it's actually, like, kind of locally invading those areas. I really don't have a good answer for you on that one. But the more, like, pervasive neurological issues, like people having, reports of people having persistent loss of taste and smell for a year post-infection. Yeah, I mean, it's possible. It's possible that, since the virus is, like, kind of concentrates in your, like, mucous membranes and stuff, that, yeah, they damage those neurons. I mean, that would make sense to me. I buy it. But yeah, I don't know. Let's find out. I love the internet. With anosmia, 1 year after let's see. Anosmia quickly emerged as a telltale sign of infection. Let's see. Persistent COVID-19 related as anosmia has excellent prognosis with nearly complete recovery at 1 year. Interesting. That doesn't really say why. Neurons to grow. But yeah, so neurons can actually grow back, but it's just really, really, really hard and slow for them to do. And, for things like spinal cord injuries, like, obviously that's a gigantic bundle of nerves, so that's why that pretty much doesn't happen. But nerves can heal. Neurons grow very slowly. So let's see if they offer some insight into why this happens. Other than just saying who recovers when. And, let's see. Underappreciate the return of normosmia. I've never seen that word before. Awesome. Mild to moderate reported persistent altered taste or smell 1 year after disease onset. Yeah, I think I just saw that, actually. That jives with this. Yeah, so they said 21. This one says 28.3, right? So, pretty close. I don't see any, like, why that happens, though. Let's see. So that's interesting. When was that published? January 6th. Okay. Let's see what the Cochrane Review says. The only complete study we found included 18 people, so not exactly the biggest study, huh? They had problems with sense of smell that lasted at least 4 weeks. They were identified using smell identification tests, blah, 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 blah. let's see. We do not know whether steroid tablets with nasal irrigation alone is better or worse than nothing. That's interesting. I wish they would mention, like, why that happens. Peripheral inflammation of nerves. Well, there you go. Boom. We're all learning today. Yay. Good stuff. I like it. So yeah, I guess it's basically you're just waiting for those nerves to calm down. And sometimes that's not easy, like especially in your nose because you use those nerves all the time and you're doing like sniffing and irritating them and stuff. So just like if you have a really bad runny nose, like you're eventually it's sort of like a vicious cycle, right? Because you're just like making so much snot that you have to like blow your nose, and like that irritates your nose, and you make more snot and you have to blow your nose, right? Like kind of the same deal, at least conceptually. Inflammation for a year post-infection? Yes, it does sound strange. But one thing that you might get a little that might inform that a little bit is how COVID affects your lungs. So COVID is a weird mistress as far as lung pathology because it can cause. So generally when you have like a lung disease, it's either restrictive or it's obstructive. So obstructive is stuff like asthma, COPD, chronic obstructive pulmonary disease. Restrictive is something like fibrosis, where your lung actually can't like stretch and expand and get air in it. So COVID does both. So COVID can lead to something called ARDS, or acute respiratory distress syndrome, where basically all the capillaries in your lungs kind of get inflamed and leaky, and they leak fluid into your lungs, and then a fluid-coated alveolus can't participate in gas exchange, so you get really sick and you can't breathe, and that's when you need to be ventilated. But it also causes fibrosis in your alveoli, so it can cause an obstructive or a restrictive pattern as well as destroying your alveoli at the same time. So it's very complex and very difficult to treat because of that. And that's why most of these people just kind of like, if you get to the point where you need ventilation, you just sort of have to ride that out and like hope it goes away. So maybe that's happening in like the mucous membranes in your nose. Don't know, but that's my best guess. So maybe those nerves are like actually damaged, like the inflammation actually straight up damages them, and you have to wait for them to regrow. Which again is definitely possible in smaller nerves like that. So that is my best guess. There is going to be much more conjecture in this talk than I'm used to, because typically we're all straight up evidence based, but since this is so new, it's sort of tough to do that, frankly. But I think it's really cool to think about these things, which is I'm glad you guys are asking good questions. Makes you think, makes you use the old noggin. Are there topical treatments to help induce neuron regrowth? I doubt it, but let's see. That seems pretty sci-fi, but hey, some sort of treatment that increase blood flow to the area. Yeah, I mean, yeah. Let's see, nerve growth factor. When did this come out? 2015? Critical role in development and survival of sympathetic. Oh, okay, so this is kind of like a... Oh no, this is actually germane. Therapeutic property of NGF has been demonstrated on human cutaneous and corneal ulcers, pressure ulcers, glaucoma, Maculopathy and retinitis pigmentosa, so like eye stuff specifically. Huh. That's cool. Let's see what they say down here. Gene therapy, heart attacks. Wow. Yeah, so maybe there's some like kind of cutting edge stuff, like research stuff that can do that. Yeah, minoxidil can increase blood flow for sure. That's how it works with hair follicles. It helps you regrow hair. Gives them the blood flow they need. Gucci Brand, what's up, man? How's it going? Good to see ya. We're exploring weird science. As per usual. Yeah, cool. So as far as like, so it says the eye drops were well tolerated, no detectable evidence. So that's all well and good, but keeping something like in your nose is a little bit different. But I don't know, maybe a nasal spray would work. If this isn't like, you know, if it's not a $10,000 a month nasal spray, which it may well be. I don't know. I don't know anything about that. But yeah, maybe there's some nerve therapy to be done. So we're talking about, what's it for? We're talking about why people with COVID, after COVID, still have anosmia, like problems with smell and taste for months to a year afterwards. And we're kind of trying to figure out if there's a way to like... So I think we came to the soft conclusion that it's probably from like neural inflammation from the virus that just needs to heal. And so that led us down the rabbit hole of, is there something that you can do to make those neurons heal faster? So it seems that the answer might be yes, which I had no idea. That's pretty cool. Cool stuff. So I like this page. This is a page from Mayo, which is not a like, scientific literature thing, but it's a really nice summary of stuff that can happen to you after COVID. And surprise, surprise, it includes all of the things that COVID targets. So we kind of talked about strokes, seizures, probably from brain damage or inflammation. ACE2 receptors in the nose. Look at you. Yeah, I forgot this was your research. Fantastic. S protein of the virus binds to, so it makes sense that it leads to smell loss. Boom. There we go. I knew we'd come up with an expert somewhere along the line. Awesome. Yeah, that's great info. And incidentally, I did not know that there are a lot of ACE receptors in the nose. I thought they were mostly in your lungs. I love this, man. It's awesome to like learn from you guys and figure out new stuff and look up things that I like never would have even considered. Quality streaming experience. So here's one that I think is really interesting. So the myocarditis, which we sort of touched on this with our friend Patrick a couple weeks ago. This is actually most common in young men. So like, healthy 20s-ish men. I don't know the exact age, like reference age that they're going after, but like basically mid 20s men. It's myocarditis is most common. Even in patients with mild or no symptoms, which is super weird. I think it is more likely in patients who have, as with everything else, it's more likely in people who have severe symptoms. But, like they've detected, I think this was kind of a big deal early on with college athletes. They were detecting people who had some degree, like some evidence of like, cardiac damage, like in labs after they'd had COVID. So, the question is, what does that mean? Probably nothing, honestly, but we don't know that, right? Because like most people don't get myocarditis. So as it says here, this may increase risk of heart failure or other complications in the future. Maybe, who knows? It's not a good thing for sure. You don't ever want your heart inflamed if you can avoid it. But if it doesn't cause you any symptoms, like you never have any chest pain or anything like that, then it's probably pretty unlikely to be significant. But again, we don't know. That's going to be something that'll time will tell, right? Like, this is probably not something that we'll see for at least 10 years. Like, if it's going to be an issue, that will rear its ugly head like decades to come. So that might be a real weird, like, zebra thing coming our way, possibly. Like, where they just have no idea why these people's hearts are failing. Like, they have non-ischemic heart failure, and they're like, oh, you had COVID. Maybe that did it. So, yeah. So lungs, I think this is probably the most, like, duh issue. That, like, yeah, you can't breathe, and therefore your lungs are more likely to get damaged, right? Okay, got it. And this is what we were talking about. There's, basically, you can get scar tissue in your lungs, and that affects your breathing down the line. So brain, this is something that I didn't know. I didn't know that COVID can cause Guillain-Barré. The only reference that I had seen to Guillain-Barré regarding COVID was with the Johnson & Johnson vaccine, which does in fact cause Guillain-Barré, but it's very rare. I think it was like 7 per million people, something like that. And I Googled this because I was like, I never heard of that, and I couldn't really come up with the evidence supporting that statement, so I don't know about that. But strokes, like we talked about, you're hypercoagulable, so you can, get blood clots in your brain. And obviously, if you have a stroke, you have the potential for having lasting issues from that. So that's not necessarily like a thing directly caused by the virus, but clearly, if you have a stroke because you had COVID, you had giant blood clots, that's a problem. What I have seen more often in terms of blood clots is pulmonary emboli. It's pretty rare for, like, unless you have a what we call a PFO, a patent foramen valve, which, like, it's basically the foramen valve is like so it's supposed to be the septum between the atria in your heart, like the two top chambers in your heart. But sometimes that doesn't close. And, like, actually it's pretty common for that to not close. It's like a quarter to a fifth of the people have an patent foramen valve. And if you have that, a blood clot can, like, pass straight through your heart. Because normally it would, like, go in the right side of your heart and get pumped into your lungs, where it would, like, dissolve eventually, or kill you if it was big enough. But what we see more often in any event is those clots go to people's lungs and sort of compound their problems, because then you have effed up lungs from the virus itself. Then you also have a blood clot that's preventing blood flow to get whatever gas exchange you could possibly muster out of those alveoli. So I'd say that's, and like we saw over here, strokes are actually not as common as I would have expected. But one thing that they mentioned that I actually hadn't considered that this article mentions is that mental illness is a real problem. So lots of these people, have been hospitalized for all these, like, survivors, and even people who are, like, still in the hospital. This is, like, a really traumatic experience for them because they're super sick. They're struggling to breathe. That's a really alarming feeling for everybody. If you feel like you're suffocating slowly, that sucks. So, like, people get really stressed out about this and have, mental trauma, and, like, especially the people who are on ventilators for prolonged periods of time, because they're the ones that have the more severe symptoms, and, especially, like, at the beginning of the pandemic, were isolated, like, they couldn't be around their families, so they had no support structure. Most of them probably remember being ventilated, because when you're ventilated for long term, they do things called sedation breaks, which basically means, so when you have a breathing tube, you're sedated because obviously your airway is not really designed to have a piece of PVC in it. Isn't there a machine that can oxygenate your blood for you without your lungs? Yes, there is. It's called ECMO. Let's look at that. You do not want to be on ECMO. This is really, really, really bad for you. So extracorporeal membrane oxygenation. And that's what it looks like. So basically, this is very similar to the bypass machine that they put you on when you have heart surgery. So, I have not actually done a whole lot of ECMO, but because that's reserved for people whose heart and lungs have just like utterly quit, basically, like they cannot oxygenate themselves at all. So the short version of how this works, and there are several different ways to do ECMO, but we'll talk about the most basic one. So basically, you pull blood from a vein. You run it through this thing, which like filters it and oxygenates it, and you can like mess with their electrolytes and stuff if you need to. And then it pumps the oxygenated blood back into their arteries. Are they effective for COVID patients? Yeah, they are. The problem with this though is this whole apparatus here is really, really hard on your blood cells. So like you get a bunch of hemolysis and like platelet dysfunction and stuff, and it's like it does the trick of oxygenating you, but it damages your blood cells really badly. And there's a phenomenon in heart surgery called pump head, which is basically just like people having these like microembolic strokes that I was talking about. So they just have like, you know, tons of like emboli showered into their brain from, you know, it being pumped through this machine here, because all of the like, you know, all the cell debris and shit just like breaks up and gets in their blood vessels. You can also get kidney failure from that, because all of that stuff goes into your kidneys too, and they like think about it like dumping a bunch of hair down the shower drain, right? It just like clogs up the drain. I mean, your kidney is essentially like millions of little tiny drains and filters. So if you dump a bunch of crap into it, they get clogged up and it starts to fail. So 1v30, what's up, man? How's it going? Thanks for dropping in. Hopefully you are enjoying the ECMO talk. So yeah, this is an absolute last-ditch effort. And given the severity and kind of the like long duration of COVID, it's not very effective because people can't really tolerate being on this for very long. You know, otherwise they start getting all of those other comorbidities and stuff. And like if you shut somebody's kidneys down, that's pretty much game over. And obviously, if you shut their brain down, that's game over too. So this is absolute last resort kind of thing. But very good question. These are the kind of interesting things you get to do if you are an anesthesiologist. I don't do these. This is sometimes general surgeons place ECMO cannula, but usually it's cardiothoracic. Really quick question. Extreme physical suffering. Are there any instances where I would support euthanasia? That's a real tricky question. So for me personally, yes, is the short answer. The requirements for me to support it, this is gonna sound really uneducated because I haven't thought about that too much, honestly, but I would say that if the patient understands that their condition will not improve and they are unhappy with their quality of life, it would be something that I would consider for critically ill patients only, as assessed by other physicians. You would need, you know, a lot of input to make that decision, right? So you need like a critical care physician. You need palliative care to be involved, which, by the way, palliative care is a fantastic service. You missed most of this, but it's interesting. Okay, well, there's more to come, baby. What if the patient has dementia and cannot realize the quality of life? Well, so that's the problem, right? So is that murder or is that euthanasia? that's a huge moral debate. If you have a living will on hand where the patient says, if I'm demented and can't take care of myself, I want this to happen, then that, like, frees things up dramatically. Because, you know, you have it in their writing, like, exactly what they want in that situation. But if you don't have that, it's way stickier. And the standard of care is talking to somebody who is close to that person, preferably who is like a legal designee of some kind, whether it's their what's the term? Crap. Power of attorney. Their durable power of attorney. There we go. Who will tell you what the patient would want, not what the power of attorney would want, what the patient would want. And, you know, hopefully you assign somebody as your DPOA who will do that faithfully, which is not always the case, but got to make sure you cover all your bases on the liabilities front. Yeah, for sure. Absolutely. Yeah, euthanasia is a gigantic legal problem, not to mention a gigantic ethical problem. So, I mean, like, I would, because I would support it for myself, I support other people's right to have that choice. Like, my worst fear is to be, like, an intractable burden on my family. That is my absolute worst fear. So I would much rather just die than, you know, live in some sort of, like, terrible demented existence where I'm a, you know, total care patient. Like, there's no reason for me to live in that existence, so I feel like other people should have that choice as well. Are there any medications while using the machine to prevent the debris from clotting in brain and kidneys? No, not really, because it's all like pieces of cell that get smashed up in the ECMO machine. Like, you're literally breaking open red blood cells. So there's nothing that'll, like, filter that out. I mean, there are filters in here, but they just can't catch everything. Yeah, it's a good idea, though. It's a good idea. But yeah, euthanasia for people is tricky, and where I deal with that most often is, you know, people who are in that situation, actually, people who are demented and, you know, they've been riding a ventilator for, you know, days to weeks, and their family just wants everything done for them, no matter what, and they don't really understand what that means. You know, they think that, you know, somehow their family member is going to recover, or, you know, that they have, like, some meaningful quality of life, but they don't realize that that's for them, not for their family member, because their family member is, like, you know, non-functional. And they don't know that, you know, with a ventilator and a feeding tube, we can keep somebody alive for months. You know, they're gonna slowly die of malnourishment and chronic infection. You know, either a bed sore is gonna get them, pneumonia is gonna get them, and, you know, we'll be able to fight those things off for a while with, like, sequential surgeries and antibiotics and all that stuff. So, like, the do everything approach is a brutal and very slow way to die most of the time. Would I say that people with severe dementia have a meaningful quality of life? Yeah, yes, and a massive medical bill. Absolutely. Those people's medical bills climb into the 7 figures without too much problem. I would say people with severe dementia have zero quality of life. I mean, if you have severe dementia, you're, like, you know, you can't eat, you can't speak, you're, like, usually immobile. So no, I would not say that they do. You know, certainly there's, like anything else, there's a spectrum, right? There's a spectrum of dementia where, like, you know, well, grandma forgot to turn off the stove. Like, you know, it's a bad thing, but, you know, she still enjoys your company and, like, knows who you are and stuff, but yeah, pay insane amounts of money to live. Yeah, quote, live. Exactly. So that's, yeah, I am definitely a quality over quantity kind of guy. Like, I don't want to do the circle the drain thing. I would much rather just jump straight in it. Honestly. And that's kind of what makes, am I DNR? Yeah, fuck yeah, I'm a DNR. Straight up DNR. Um, but that's one thing that makes COVID really scary. Is it is a slow burn. Like these people stay in the hospital for a good month and a half before they finally like kind of hit a wall, and a lot of them die of heart failure. Actually, like they, they have respiratory failure obviously, but their heart just kind of like craps out, basically. Like of getting poor oxygenation for so long, it just like can't handle it. But yeah, I'm a DNR, and this sounds really morbid, but I have really good life insurance. So, like, if I'm in a situation where I get, massively fucked up, I would, for my family's sake, I would rather die than be, you know, a vegetable or, have this, like, monumental fight to get back to, like, some sort of, minimal functionality. So yeah, I would rather my wife be set for life, my wife and kid, than, have to fight that fight. The stream got dark. Yes, it did. Hey, you're the one that brought up ECMO, dude. This is your fault. Totally your fault. But I mean, these are things that you think about, when you deal with it all the time. Like I see this constantly. The dude that I was taking care of Friday died in the ICU. Like we tried to. This is actually a really interesting case. So he was going for a tracheostomy, which you often do for long-term ventilated patients because having a breathing tube is like really traumatic for their trachea, and a tracheostomy is less so. And so what that implies is that placing trachs is like a bridge to recovery. This guy was not recovering because he was basically on maximal ventilator settings. He was on like the most. So there's a setting called PEEP, which is positive inexpiratory pressure, and that's like pressure that the ventilator keeps applying at the end of an exhalation to keep your alveoli open. So like otherwise, if you maximally exhale, some of your alveoli collapse. And so if you have more PEEP, they call it PEEP, then that's less likely to happen, and your oxygenation's better. So he was on 100% oxygen and maximal PEEP, which is, well, actually more than what I would consider maximal PEEP. Because if you get too much PEEP, after a while, you're like squishing all of the blood out of your lungs, basically, so your heart struggles because it can't get the blood flow that it needs to actually like pump. So there's a point where like too much PEEP will lower your blood pressure. But yeah, so this guy was not recovering, and he had what we call a bronchopleural fistula, which means basically he had a hole in his lung that communicated with his his chest, basically. So he had a chest tube in, and basically every time his ventilator would drive the bellows, his chest tube would bubble. So like that breath would just go like straight out that fistula. And a fistula is like a hole between two things, by the way. So it'd go straight through that fistula and like out drain into his chest tube. And so as soon as we took his chest tube off of suction, basically he just got a giant pneumothorax and crashed. And like we got him back from that, but I think he died like 2 hours later or something. I have no idea why we were doing that trach in the first place, but like, so one interesting thing about COVID is that you're thinking about it because you work with dementia patients. You couldn't see how they have a meaningful quality of life with zero awareness. Yeah, I mean, I agree. Right. Yeah, like they don't, all of the things that would have been positives in their life previously are like unattainable. Even like memories. So that's a miserable existence in my mind, and not one that I want. So yeah, COVID. Since as we've discussed, it's kind of a slow trip into the crapper for a lot of people. Something that has happened is that people sort of get discharged in a not an unstable state, but certainly like a state that they normally would not have been discharged in. Sorry for derailing. That's not derailing the convo at all. We're good, man. That's what we're here for. Like I like these kinds of talks because clearly I am not an ethics authority at all. So I like having other people's input on that sort of stuff. But anyway, yeah, so people are getting discharged basically to make room in hospitals. And I know, like, one woman I saw who came back, she had pulmonary emboli, like we were talking about earlier. She had pulmonary emboli in both lungs. And she got discharged home on 8 liters of oxygen through nasal cannula, which is a ton. Getting discharged home on oxygen at all when you weren't on it before is a ton. And not something that would normally ever happen. So 8 liters is a shitload. Like, most people are on 1 or 2. But she also had a giant blood clot in one of her arms. Then that may be where the emboli came from, actually. But yeah, so she had an untreated blood clot and also a huge new oxygen requirement, and she got sent home. Not to like a care facility, like home. So that's like where we are. That's where hospitals in this country are. So that's kind of scary, but that's because it does take so long to recover from. Like, all of the people who are really sick, who are that sick, are in the hospital for, months, at least weeks. So, and those, like we were talking about earlier, those are the people who have, like, traumatic experiences. Like, this woman in particular, like, I told her we were going to have to intubate her again, and she was like, I'm so worried about getting this tube out. And I was like, there's a pretty good chance it's not coming out. But, after the surgery. And she was like, so the surgery, in case you're curious, was trying to get out her pulmonary emboli. Like, actually go in there with, so interventional radiology was doing it. So they were doing like an x-ray of her chest, like a live x-ray of her chest, which we call fluoroscopy. And, like, fishing a wire up into the blood vessels in her lungs and trying to pull out the clots. Or break them up with, like, an anticoagulant. And they ultimately could not do either of those things. But it was a valiant effort. But yeah, she was terrified, because I think she'd been on a ventilator for a couple weeks, maybe. I think maybe like 2 weeks or something. She was young too. I think she was in her 40s. What is one long-term effect I'm scared of for COVID? Like, for myself? Yeah, for myself. I mean, I don't want respiratory difficulty for life. That's probably the thing that I would be most scared of. And that's also, from, like, anecdotally speaking, that's the most likely thing that would be like a chronic, like a maiming sort of situation that I've seen. Because, like I said, I haven't, like, specifically noticed any of the people complaining of, like, fatigue or, malaise and, like, myalgias and stuff, like muscle pain. Like, usually what I hear is I'm having trouble breathing, because that's, like, most alarming to people, probably, so it's like a reporting bias kind of thing, probably. But yeah, I mean, I wouldn't want to have my function compromised just because I got sick once, like, and especially for me, if I get COVID, like, I'm healthy and young, like, and vaccinated, so chances are it's gonna be, I'll just sort of feel like shit for a couple days or a week or something, and then be fine. And so to, like, have that and then, be like, oh, I can't exercise anymore. No, fuck. If you get COVID, your goose is cooked. What? Why? Shouldn't be cooked. You're a sprightly young lad as well, as I recall. Non-traditional status be damned. Ooh. Yeah, so one thing that sort of bears mentioning is, like, there's a huge economic impact of COVID too, right? Between, the actual, like, straight up economic shutdown and all of these people being out of work for so long, that's, like, obviously our economy's doing just fine, but, there's lots of shakeup from this still, like smaller lots of small businesses closed, and you know, other small businesses are having trouble hiring people, and it's just sort of a weird cluster. Do I know the differences between long-term effects of Delta versus older variants? I do not. I do not know the difference. So the symptoms of the two are different. So like the original strain of COVID had the like anosmia, the changes in, you know, smell and taste and stuff. And also was, well, I have a chart on that actually. Look at this. Let me see here. I have a chart. This is really simple. I have a chart of this in the COVID video that I made, but I didn't want to open up my personal Facebook. It's probably a bad idea. Hey everybody, MilkmanAl here. Yep, there's the video. Let's see, view more video details. This is a really simple chart, so it's probably not worth the effort I'm putting into this. But yeah, so basically the big take-home point is like the original strain had the anosmia and all that stuff, and the Delta variant is like more general sort of like sickness stuff. You know, it's like what most people think of as colds. Do I have... What the hell? What is the problem here? Okay, well, we're gonna do this a different way. So, see you later, ECMO. You look really super cool, but we're moving on. COVID Delta versus original. I don't know what the original strain is called. Like, I actually got this from some, like, random non-scientific site, but it was a good chart. Symptoms. See, this is interesting. The symptoms of the Delta variant appear to be the same as the original version of COVID-19, so that's not true as far as I'm aware. That's from, like, UC Davis, which is kind of weird. Like, I understood that the Delta variant is, like I said, more typical cold symptoms and, like, hits the anosmia less hard. Like, that's not one of the most prevalent symptoms. But, anyway, so, if I had to guess, so people with the Delta variant are generally sicker than people with the original strain, so I would say that it's probably more common to have basically every long-lasting effect if you're infected with Delta. But again, that is just a guess, right? This is still new, and I don't think any science exists on this. Like the study that a serial killer linked to us is the biggest. Oh, that's not that one. Oh yeah, it is. Yeah, this is the biggest one that I've seen, and it's like 1,500 people or something. So as time goes on, we will get much better data on this. Yeah, 1,555. Oh no, excluded. 1,250. Yeah, so it was like 2,400 people, which is a fair size. And this is all from Wuhan, so these are the people who like originally had it. Song is your jam. Yeah, I thought I'd switch the music up a little bit. This is Atlas M by Backing Track. Yeah, I was getting a little tired of the stream beats. Just listen to the same songs over and over. So, you guys should know that I'm a huge advocate of Devin Nash, who is basically he's a marketing agent for like high-end, the highest end digital personalities. So, anybody who's like a YouTube or Twitch creator. And he has in his Discord this DMCA free music section, and I got this whole track list from there. So like people just kind of come in here and post, you know, their creations, whatever they are. Apparently there's a whole bunch of pontificating here, but mostly there's a bunch of links. So there's like link there. And, you know, keep in mind that these people get paid for this too, right? I think they make like half a cent per play. So if you're looking to support some small creators, that's a great way to do it. So this is, let's see, I think it's like discord.gg/Devin Nash, I think is his channel. So, but his content is fantastic too, by the way. There's like a whole bunch of like self-helpish kind of stuff going on in there. You know, how to like, I mean, it's specifically targeted at like how to grow your digital media, but it's also, you know, very like generalizable, like how to start a business or, you know, how to succeed at anything essentially. So lots of interesting stuff there. Definitely recommend him. Very good resource if you're actually like trying to, you know, grow a stream or something. So it occurs to me that we have a video to watch. Maybe we should do that. I hope I didn't close it. Did I close it? No, that's my printer. Okay, well, I'll just go back to the link. It's all good. Let's see. Oh, it's right here. It's right in front of me. What the fuck? Dismiss that. Alright, well, now that your jam's over, I'm gonna mute that so we can listen to this formerly very... Oh no, where'd it go? Very loud song. Or loud, There it is. Alright. Natural COVID. So here's an interesting thing to note about this. So the title here, could natural COVID immunity be better than vaccinated immunity? And the answer is absolutely yes, right? Like that's actually the case for most diseases. An interesting thing the thing that I wanted to mention is that there are a couple studies, small studies, admittedly, so not like super high quality, but there are a few studies that indicate that patients who have gotten COVID and then gotten vaccinated are less likely to get disease again than just patients who have had COVID. So that indicates that the vaccine does still help if you've had COVID before. So I guess I'll take this opportunity to say, hey, if you haven't gotten the vaccine yet, you should. They're safe and effective. Please do it. And I actually was looking at this earlier today. If you are here, if you are any of those things, you are eligible for a booster. And I would suggest considering that very strongly. So anyway, let's watch the video.
Hello, welcome to my channel, Medicine with Dr. Morin. If you've not been here before, I'm Dr. Keith Morin. Is a natural COVID infection really 13 times better than being vaccinated?
Doubtful.
My viewers have been asking me to review a new study that everybody's talking about. This study, performed during the recent Delta outbreak in Israel, demonstrates natural immunity to COVID.
Is this loud enough, by the way? Let me know if the audio is
Here
messed
is
up.
the study.
It sounds pretty quiet to
The
me.
study investigators did a retrospective observational study comparing 3 different groups. Now, it's important to note that the authors of the study had no financial disclosures and there was no commercial funding. The study is in preprint and it's not peer-reviewed. The first group had never been infected with SARS-CoV-2 and they received 2 doses of the Pfizer vaccine. The second group were previously infected individuals who had not been vaccinated, and the third group were previously infected people who received a single dose of the Pfizer vaccine.
So I just want to stop this, and ask just a sort of a whimsical question. How the fuck does this guy have 165,000 subscribers? He has the driest delivery I've ever seen. Please God, tell me that I am not this like insipid when I'm talking about things. Oh, well, you know what? If there's hope for Dr. Moran, there's hope for me.
The study looked at 2.5 million people in the Member Health Fund in Israel, and this covers 26% of their population and provides quite a representative sample. The study population included people older than age 16 who were vaccinated before February 28, 2021, or who had had a documented SARS-CoV-2 infection by this date, or who had both the documented infection and then received one dose of the vaccine 3 months later. Of interest, on March 2, 2021, the Israel Ministry of Health changed its guidelines to allow previously infected SARS-CoV.
You got a little NOS ad. Awesome. That seems to match my content pretty well. Yeah, thanks Twitch AdSense. Nice. I knew we needed some gay black cowboys up in here. That was next. That's the next thing that we're doing. Yeah. Broke back COVID.
To receive one dose of the vaccine after a minimum 3-month interval from the date of infection. They followed all of these 3 groups from June the 1st to August 14, 2021, when Delta was the predominant strain in Israel. Here are their study results. First, they compared vaccinated individuals versus previously infected people, and they matched for the time of the second vaccination and the time of the documented infection. They wanted both to occur between January 1 and the end of February. So what they were trying to do here was to match the time their immune system was activated in both groups, and then after that examine what the protection was from either vaccination or natural infection. They matched 16,215 people in each group. There were 257 infections, of which 238 occurred in the vaccination group, meaning a breakthrough infection, and just 19 in the previously infected group. Now, this represents a 13 times increased risk for breakthrough infection as opposed to reinfection.
So that's a little misleading, right? So let's track back to their numbers. It's just sort of a the numbers are the numbers, right? But it's a little weird to put it the way that he did. So 238 divided by 16215. Whoops. 5. So that's 99.85%. And then 19 divided by 16215. So that's 99.9, right? So that's, or 99.8 versus, so to say that it's some multiple more effective is kind of, sensational, I guess is the word that comes to mind. More effective, sure, but that difference in percentages is actually really small.
Infected group. Now, this represents a 13 times increased risk for breakthrough infection as opposed to reinfection. Statistically, the likelihood of this result occurring by chance would be less than 1 in 1,000. They then looked at symptomatic infections during the follow-up. There were 199 total cases, 199 in the vaccinated group, and only 8 in the previously infected group. This represents a 27 times increased risk for symptomatic vaccine breakthrough infection as opposed to symptomatic reinfection in the natural immunity group. Statistically, the likelihood of this result occurring by chance would be again less than 1 in 1,000. Now, there were 9 cases of COVID-19 related hospitalizations, 8 in the vaccinated group, and only 1 in the previously infected group. No COVID-19 related deaths were seen in either cohort.
I was taking a sneak
Next,
peek
they
at the
matched
comments.
14,029 people who were previously infected with people who had been previously infected, then subsequently got vaccinated. 81% of this group had their single-dose vaccine after their positive PCR test. When they analyzed all the data, they did find a trend towards reduction of risk of infection, but it did not achieve statistical significance. That may be due to the fact that there were small numbers of reinfections in both groups.
Right.
In summary, this study is the largest real-world observational study we have comparing natural immunity gains from previous SARS-CoV-2 infection to the Pfizer two-shot vaccine-induced immunity. There was a 13 times increased risk.
COVID-19 PCR tests are meaningless, though the whole world relies... okay. Though the whole world relies on PCR to diagnose COVID infection, the science is clear they're not fit for this purpose. Okay, so what's your point? So this is an interesting video. I mean, I don't know anything about the quality of this study. You know, who knows? But like we were talking about, it's pretty likely that's the case, right? But again, there are studies that show that what he was talking about, you know, people who have gotten COVID and then get vaccinated, indicated that that is helpful. And like we've, you know, sort of been over ad nauseum in this stream, what's the drawback? What's the drawback of getting vaccinated? You know, especially if it's what's my point? My point is I wanted to know why you posted that quote regarding PCR. And like, I don't think anybody's using PCR to diagnose COVID, as far as I'm aware. People are using it to count viral load, which is very effective. In fact, that's like, oh man, I miss Discord. Oh, good stuff. The little NOS representing. I love it. By the way, Diamond's Edge, I did not say hi to you. Thank you for joining us. Appreciate it. hope your week's going well, dude. So yeah, I don't know how much more I can handle of Dr. Moran here. But let's look at the comments, because we all need a good laugh, right? So he confirms that yes, natural immunity is proven to be better. Yeah, this is like, man, I hate comments like this. Like, it's just some dude talking about this. Yeah, man, good to see you. Good to see you. Like, yep, this guy talking about it, that absolutely proves what I thought was true is definitely 100% true. Okay. Yeah, who did the study? I have no idea. Let's see if it's listed in the description. Probably not. Let's see. Oh, Israel study. Here we go. Natural immunity playlist? Okay. Let's see. Yeah, so this is like, I mean, just, you know, reading their abstract, it seems reasonable. The problem is, so who did the study? It is people in Israel, I believe. It is not, here we go. This article is a preprint and has not been peer reviewed. Okay. Well, that makes a big difference, doesn't it? Yeah, so basically that means that they can say whatever they want, right? There's nobody who has actually vetted all of this data. But again, like I was saying, it wouldn't be super surprising if natural immunity was better. Unfortunately, natural immunity comes with the necessary trial of being infected with COVID proper, right? science nowadays is generally posted on preprints while it's waiting to be peer reviewed. Yeah, yeah. I mean, I agree. But and you actually probably know a lot more about the peer review process than I do, because I stay as far away from practicing research as I possibly can. But yeah, from what I understand, it's a very political and long drawn out sort of thing to do. But yeah, I mean, grain of salt, right? Huge grain of salt for this, especially something that's kind of like, maybe cutting edge. It'll probably end up being a Nature paper. Maybe so. Maybe so. But that would certainly lend a lot of credence to it, right? You get published in Nature, people take notice. But yeah, again, like, this is interesting to know, but, you have to get COVID first to get that immunity. Whereas a vaccine, you just get a shot in your shoulder and you're good to go. Or 2 shots, I guess. But yeah, that's sort of the inconvenient little wrinkle in that plan. So yeah, cool video. Glad to see that. I actually hadn't seen any science comparing like natural immunity to vaccines yet. Good stuff. Appreciate that. I knew you could Site's article not peer reviewed yet. Sus. Yeah. Yeah. But not terrible, like Gucci Brand says. I mean, it could be worse. And it doesn't, it's not like they're saying, vaccines slaughter everyone, will make your face explode. Like, what they're saying is like, it tracks logically. But nah. We'll see. We'll see how that shakes out, right? Fortunately, we've got literally a world full of data points to sort of suss that out over the next while. Oh, night. Zaddy daddy. See ya, man. Thanks for hanging. Appreciate it. Hopefully you enjoyed that segment of the talk. Let's get some rock going on here. Back to your regularly scheduled DMCA free music hour. Cool. What else were we going to talk about? I feel like we were going down some other rabbit hole before we went there. Oh well, whatever. Anyway, yeah, so that's cool. So, yeah, long-term COVID stuff, kind of scary. Like, the heart stuff is going to be really weird to see. Like, that might be sort of similar to rheumatic fever, where down the line. Oh, Lil Nas, look at this shit. Oh, man. Fantastic. He is so stylish. Yes, he is. What a guy. Holy crap. Proud to have him advertising on my channel. That is great. I really wish Twitch had better discoverability and like better algorithms for stuff. That would be so cool. I mean, so instead of, coming to a stream where we're talking about medicine, you get a fucking Little Nas X ad. Oh, I love it. Oh, man. Okay. Oh. Yeah, no, it's honestly, it was the best. Yeah. I mean, it really couldn't have started the stream off better, right? It sets the tone very well. We could talk about Little Nas all night. Yeah, man, he's the shit. He makes me really happy. Like, somehow this like flamboyantly gay black dude becomes a massive country star. Like, how does that happen? There's all sorts of like, Reno Vegas, what's up, man? Haven't seen you for a while. He's totally an icon. Yeah, man, I love it. It's just like turning the whole world on its head. Like, I saw a meme the other day from fighting the Nazis. What Nazis are you fighting, dare I ask? AKA the anti-vaxxers. Yeah, okay. Yeah, well. Fortunately, we're kind of at this point where this new album makes you happy. The Karens are angry at Lil Nas. Yeah, I mean, he's pretty anti-Karen. Like, let's be real. He's wearing all their clothes. So, yeah, I mean, we're at least at a point where, you know, we're pretty close to everybody either getting COVID, or everybody in the U.S. at least, getting COVID or getting vaccinated. So maybe we'll get some freedom back here over the next couple months. That would be nice. 71% first dose. Let's have a look at that, by the way, because I've made a habit of tracking. That's way higher than last I checked. I think it was like 58 last I saw. COVID vaccine. US. Boom. Need more black and queer in media? Yeah, dude, why not? That sounds like it'd really add some spice. So this says 65.5 as of 2 days ago. That may be inaccurate. I think Our World in Data gets it. Let's see where they get their stuff from. I think they get it from the CDC. Oh, maybe not. It's out of London. That's weird. Okay, so there might be some lag there. In any event. Good news. Good news, everyone! I like that this trend is still going up, though. That's encouraging. Total doses 398. Wow. That is a lot. That's pretty cool. I know serial killer is a little more down on the prospects of like us achieving herd immunity anytime soon, but I remain cautiously optimistic, even though I continue to bag and tack people from COVID pretty much on a weekly basis. Me personally, that is. But I also live in, you know, rural land where COVID was, you know, never existed. But can you imagine, so to your point, Cockroach Princess, about black and queer people in the media, I want more Ruby Rods. And if you guys have never seen The Fifth Element, first off, stop watching my stream right now and go watch it if you haven't. But if Ruby Rod could do, like, world news, that would make my frickin' life. Like, everything would be complete if Ruby Rod did world news every day. Oh my god. Okay, so we're gonna watch Ruby Rod because I'm now inspired. It's Chris Tucker. Yeah, damn. Holy shit. I haven't seen this movie in a while, and I miss it. This is probably gonna be real loud. Nope.
What are you doing? Your bots. I can see it's in theaters. I'm going to be late. My pants are on backwards.
Your B-bot is super weird. Hashtag landfill.
Run's gone wrong. Rated
Oh my
PG,
god.
Only in theaters.
But yeah, that needs to be on network TV. For real. Amen. I think that was... RuPaul was probably contemporary to this, right? 97? RuPaul was real popular back then. When was Tu Wong Fu, thanks to everything Julie Newmar? Man, we are really going far away from COVID effects, aren't we? Tu Wong Fu, thanks for everything, Julie Newmar. When is it? 95, right on, baby. I love this. Yeah, this is this is not medicine. It's medicine for the soul, right? Not for really sick people who need ECMO. Yeah, we've he is, yeah, RuPaul's probably what, 60 something? Let's see. RuPaul. Born 19. God, I am on point tonight. 61. Boom. Oh, nope, 60. 6'4". Yikes. Didn't realize that. Good for RuPaul. You guys ever watched that, like, RuPaul's Drag Race? That is a hilarious show. It's really funny. I can only tolerate it for maybe like 10 minutes at a time, but it is quality entertainment for sure. Great stuff. All right, what else do we need to talk about? Doesn't look that, no. You know, a lifetime of Seasons 1 through 12 and All Stars. You watched almost all the seasons? That is dedication. Holy shit. Good for you. You should put that. I'm that gay. Nice. You should put that on your med school app. I think they would be really impressed. At the very least, that would be a huge conversation generator, right? Yeah, that should be like your top credential, right? It's like that. Like, I have watched all of the seasons of Drag Race, and I got a 30, or what's MCAT scored on now? I got a 520 on my MCAT. Is that a good score? It's a good score, right? God, I'm such a freaking boomer right now. Fuck. Violet Chacky? 520 is an okay score. Okay. Okay, I have to look this up so I don't feel like such an idiot. Is this even what I want? Score range. Oh, so 520 is like fucking awesome. Okay, got it. Got it. Roger that. So that's what a like 38 or something used to be. Cool. So yeah, clearly still less important than watching every season of Drag Race. The Discord that's playing the stream, it's here I'll I don't know if I can invite you to it. I guess we'll find out. No, I can't, which is weird. But it is discord.gg/Devin Nash. I'll type it out for you. And it's Backing Track is the name of the group. So you could probably search it on Spotify. I think it's on Amazon Music too. This is actually pretty good. This is definitely a substantial upgrade from Stream Beats, in my opinion. That's Violet. Oh wow, that is ornate. Very nice costume. Yeah, and this is actually a really good place to go for like business talk and any like, you know, content creation sort of stuff. Like it's a very high quality Discord with lots of like the comments I'm reading on Discord. Oh, it's an MCAT Discord. It's I don't think I can invite people to this either actually, but I will try. Oh, yep, sure can. Let's see. Boom. Yeah, I'm actually like live there right now. Usually whenever I talk medicine stuff, I go live there. I try not to waste people's time when I'm, you know, just streaming games and stuff. But they were drag something else. That is pretty impressive, honestly. But yeah, the admins. Oh, by the way, it occurs to me that I'm remiss in my traditional duty in calling Sir Pixel, currently known as Sir Ghost, a gigantic noob. But thanks, Sir Pixel / Ghost noob, for allowing me to broadcast on your channel. I appreciate that. Pixel's a gigantic noob. But yeah, definitely appreciate the forum to spout my endless ideas and opinions. Hopefully most of it is factual, but all I get is the hate. Hey man, I mixed the hate with a little love. There's a lot of love here. It's called tough love. Oh man. No, it's good stuff. But seriously though, I try not to, like, if I'm just streaming gaming stuff, I try not to mess with y'all. Even though maybe I should, because I'm always open to people asking me questions, but I try not to abuse the privilege, if at all possible. Yeah, by the way, I like the like, fuck off avatar you gave me. The wide peepo glove hand. Get vaccinated thing. I seem cool to Shadow? Well, that's because you don't know me very well. Yeah, but for real though, like, come shadow me if you guys are ever in Kansas City, all you have to do is contact me. You love emotes and Adam where you can. Nice. Yeah, well, New York City is a little far away from me, so that might not be happening anytime soon. I actually have a med student coming to shadow me tomorrow. He's I think he's doing a rotation in like internal medicine or something at the hospital I work at, and like literally came into the anesthesia lounge. Just so our office is like right inside the doors to the OR, to the main OR, and he just walked in and was like, "Hey, my name's this. Can I shadow somebody? Like, can I come and rotate with you guys?" I was like, talk to the medical staff office. If it's cool with them, it's cool with me. Come on in. Yeah, I mean, basically anybody who gives enough of a shit to, like, go out of their way to contact me, come on. Like, you can do whatever you want, as far as I'm concerned. He will actually get to participate in stuff, though, because he is credentialed at the hospital. Oh, as far as I'm aware. I'm gonna have to check on that, but you don't learn if you don't do, in my opinion. So everybody who comes and shadows me, like, gets involved. Actually, the last person who shadowed me was, if you guys haven't, I'm gonna recommend a video for you. And please be aware that this is not safe for work and also very inappropriate, but I'm gonna share it anyway. And also my mic was really fucked up during this because my kid messes with my audio stuff a lot. There's like a bunch of knobs. I don't know if you guys know what a Blue Yeti looks like, but there's a bunch of knobs and stuff on it, and he turns them constantly. But where is it? This one. Do yourselves a favor and watch this. This is actually from my favorite stream that I've ever done. But there's an episode in there where I talk PRP booking a flight so you can shadow me. Money well wasted, my friend. But yeah, I talk about a dude just basically shoving a gigantic carrot up his ass, and that was I had a guy shadowing me that day. So he got to see that, and he also got to see a redo heart surgery, which was super cool. I mean, that's for our I mean, that's pretty rare anyway, but for a hospital like ours, which is kind of a, you know, we do about 150, 180 hearts, something like that. Did he get to help pull it out and then put it back in, and then pull it out and put it back in and pull it out? I think that was the problem, actually. But no, he was very much under general anesthesia when it came out for the final time. But yeah, this dude who shadowed me, he was actually a high school student, and he was like, he got to see all sorts of cool stuff. So we did the redo heart surgery, which again is like very rare for my hospital. We did a couple like nerve blocks, which are super cool to see because, you know, it's real quick. It takes like 5 minutes to do. Oh, so when I start talking about stuff and it makes no sense to you and you guys don't, I'm sure he immediately told everybody that story. If you don't know what the fuck I'm talking about, please stop me, because I just start talking about medical stuff and I assume that you know what it means. Nobody here knows what a nerve block is, and I gather that. So this is what he saw. So a nerve block is basically, I mean, it's exactly what it sounds like it is. You basically find nerves under ultrasound. Well, these days under ultrasound, you don't have to use ultrasound, but so you just do that, and then you put a bunch of local anesthetic, like lidocaine kind of stuff, next to him. And basically, in this case, so this is your spinal cord. These are your nerve roots that go down your arm. This whole area here is called your brachial plexus. And so an interscalene nerve block gets the roots of your 5th, 6th, and 7th cervical vertebrae. And basically makes, well, most of your arm numb. Your upper arm numb and most of your lower arm. Misses some parts of it, but like the radial parts of your arm. But, yeah, so he got to see this done, which looks really cool. It looks like, I wish I just had a picture of it. The pictures? Yeah, so this is how you do it. Use an ultrasound like right there, and all of those nerve roots come out of your neck like right here. And just put a little, you know, you need like a 2-inch needle. It's a pretty short needle. Do we have a picture of an interscalene nerve block? Where the fuck is it? Okay. Those are not helpful. That's weird. Yep, well, let's see what they have in the video. We don't need sound. We need pictures. Let's see. That's probably pretty good. So, there's the needle. That's like a unbelievably good picture of a needle. I do not see the brachial plexus in there, though. So it looks like they're kind of fit. There it is. So here's a brachial plexus. You can see the nerve roots. There's one kind of squished right in there. So that's probably 5, 6, and root 7. So when you do an interscalene nerve block, the classic sign is they either call it the snowman or the stoplight. So if you see like perfect anatomy, those three will be like stacked on top of each other. And just like, you know, clear circles instead of these weird like, you know, triangle looking things that they look like in this. But as you will find out, those of you going into medical education, the classical presentation is very rarely what you actually see. So usually when you do this, you can see the subclavian artery. Okay, oh cool, yeah, so that's a middle scalene, anterior scalene. Your brachial plexus is right in here. And then your subclavian artery will be, you can kind of see it pulsing, it's down here somewhere. Yeah, so I know this probably looks like a bunch of gunk to everybody, but once you, so like here, get the fuck out of here. All of this stuff is your brachial plexus. Those are a whole bunch of like really big nerves. Once you do that a couple hundred times, you get a pretty good idea of what's going on. Anyway, so the student got to see that. Like, I did one of those really quick. And, I mean, he got to see, like, the whole, like, gamut of cool stuff that we do. Because, like, the hearts... So the reason that a redo heart is a big deal is... so whenever you damage anything in your body, it scars. Or can scar. You know, it's not just your skin. So when you cut into somebody's heart... your heart scars too, and it can scar to your chest wall. And the sternal saw that they use looks like this. So it's got this like little guard on the end, and that is literally, that's a terrible picture. Let's see if we can find a better one. So it has that guard on the end, and that guard is literally so that you don't cut somebody's heart open. Like, that's what it's for. It's to, like, prevent you from sawing through stuff below the sternum. So, if your heart is scarred to your chest wall, you're much more likely to cut into it, right? So you can cut open somebody's right ventricle, because that's, like, right behind the sternum. So you have to do this, like, very slowly. You know, to make sure you don't create more problems than you're fixing, to say the least. So he got to see that done, because usually for a heart surgery they fire that thing up and then just go rip, just like open somebody right up. But it's about a 10 to 20 minute process with a redo. Usually, sometimes longer, sometimes it goes super smooth and there's no scarring, but generally it's a much bigger deal than just opening somebody up for the first time. But anyway, he picked a really good day to be there. Saw the ass carrot, saw the redo heart, nerve blocks. Solid use of his time. Which is good, because he, like, literally lived on the opposite side of the city. And Kansas City is gigantic, so that was like an hour drive for him. But, again, worth his time. So yeah, I'm not sure how to handle. I've never actually had like a med student, so I'm not sure how to handle that, because he's not going to know how to do anything. But we'll see. We'll see how this goes. I mean, I had med students when I was a resident, but they were all like, you know, experienced with anesthesia. Like they'd done anesthesia rotation, so they sort of knew what was going on. Plus, they weren't my responsibility. They were my attending's responsibility. So I was kind of like, no, whatever, do whatever you want. I don't care. But now it'll probably be the same thing, but you know, I have to like shepherd him around, and I don't know if I'm gonna leave him with an anesthetist or kind of have him bounce around with me or what. But I guess that'll sort of be determined by what kind of things I can let him do. So I like have him start IVs and intubate people and stuff if I can. Might as well. Music is definitely a huge upgrade. I hope you guys agree. I'll maybe dig a little bit more into that that Discord to see if I can find some more stuff too. This is a pretty long playlist. I feel like there's like, yeah, 80 songs. Not bad. Sweet. Well, y'all, I think I might log off for the night, get some sleep. I got 24 hours of work tomorrow. This was fun, though. This was good. We went lots of places that I would never have expected a COVID talk to go, but that's why I like doing this. Hey, you take care too, man. Appreciate the stream anytime, dude. I appreciate you coming by. I hope you guys enjoyed it. I'm the goat. Yeah, I don't know about that. Yeah, good talking to you too, Gucci. You guys are awesome. Man, y'all are very loyal. I appreciate you spending your Wednesdays and Sundays with me. It's cool. Cool to see the same people showing up. I'm glad you get enough out of this to spend your valuable time here. So, yeah, anyway, for the rest of you, I'm MilkmanAl. I appreciate you watching. As I just kind of mentioned, I am usually live around 8 p.m. Wednesdays and Sundays, if I can manage that. Yeah, I will probably edit this into something useful for the, you know, COVID talk stuff. So if you want to watch a condensed version of all of our meandering ramblings, then please feel free to do so on my YouTube channel. Anyway, thank you guys for the stream. Thank you for making the stream. It really makes everything way more enjoyable when there's people to talk to. So that's good shit. If y'all ever have any questions, please hit me up, DM me, whatever. Yeah. Have a good one, everybody. Thanks again. Fun stream. I enjoyed it. Lil Nas X is the man. I hope he continues to advertise on my stream. He's gonna propel me to greatness. Pretty sure. Have a good night, everybody. Take it easy.